I'm Dr. Sharath, consultant plastic surgeon. My main interest is cosmetic plastic surgery. Today's video, I would like to take you through a breast reduction surgery from a patient perspective. Women who have large breasts, saggy skin, stretch marks on the breast, and who are affected by this breast size and would like an appropriate shape of the breast are the right people to have breast reduction surgery. Women with large breasts who've got symptoms due to that, which are like neck pain, inflammatory irritation. That means in the crease below the breast, there is itchiness, skin changes, and due to the weight of the breast, they become conscious. They feel that for their body proportion, the breast size is larger, and if they feel that they feel more sensitive when people are looking at them. These are the people who would benefit from breast reduction surgery. Now, identify a surgeon that you're comfortable with, who takes you through the steps of this surgery, and you are confident about the abilities of the surgery, ideally a plastic surgeon. And mention about the medication that you're on. There might be some inappropriate medication which might need to be stopped prior to this surgery. The surgery is done under a general anesthetic. It can last from 3 to 5 hours. Depending on the size of the breast, the surgery duration can vary. A marking is done of the breast to be reduced, and you can have a rough idea of the breast size that you might end up with after the surgery is done. The surgery, after proposed surgery, there will be 2 drains put on each side of the breast, which will be draining any fluid from underneath the breast tissue and the muscle wall. There are 2 kinds of breast reduction procedures. One is a vertical breast reduction, another is a T-shaped breast reduction, another is a liposuction. Liposuction might not be ideal for all candidates in breast reduction surgeries and used for small volume breast reductions. A vertical breast reduction involves an incision, a cut mark around the areola, and a vertical drop from below the areola coming to the breast crease underneath. Now, inverted T-shaped breast reduction involves a cut around the areola, a vertical drop from the areola to the breast crease, and a transverse incision which lies in the crease. After the surgery, inside the theatre, we put them on. After the wound is dressed and the drains are put in position, the individual is made to wear a garment which is like a sports bra, which fits snug with the reduced breast. And the recovery period involves quite active mobilization, and the patient may be fit to be discharged on the 2nd or the 3rd day, depending on their comfort level and the surgeon preference. The drains may be removed on their discharge or at the time of their discharge, or they might be asked to come back at a later stage for the drains to be removed, depending on the amount of fluid which comes out through the drains. Sutures are usually absorbable sutures, and the wounds need to be dressed if they are soaked. The sports bra needs to be worn for 6 weeks, and the support needs to be given to the scars so that they become very fine and settle down and become inconspicuous. In women who are unmarried, a reduction surgery is done, but an explanation is given that their lactating ability might be affected once they become pregnant in future, or if that is the idea of breastfeeding in a future setting, which might be affected. Women who were conscious about their breast size, or who felt that their breasts are too heavy compared to their body, and were conscious that people are observing, or they were finding it difficult to actively engage in sports activities like tennis, and people with neck pain and back pain due to large breasts would benefit immensely from this surgery. Improved self-esteem and confidence in wearing certain kinds of clothes would be the benefit to these kind of women who initially might have thought that there is no recourse or answer to their large size breasts.